Corynebacterium, they are gram-positive, they are null-model bacilli with the irregularly stained segments. They are frequently show club-shaped swellings for the Corynebacterium. They are classified as based on the categories on their symmetry and their shapes. C. diphtheria. This is the most important member of this genus, causes the diphtheria disease. Diphteriotes, they are the commensals of nose, throat, nasopharynx, skin, urinary tract and the conjunctiva. Introduction. The diphtherios. They are leather-like, tough, leathery pseudomembranous. They are also known as Klebsiella bacillus, causes the diphtheria. Diphtheria, this is the inflammation of the local tissue of the upper respiratory tract infection with the production of toxin which causes a systemic effects on heart and the peripheral tissues. Diphtheria is an acute toxin-mediated disease caused by toxigenic Corynebacterium diphtheriae. It is very contagious and potentially life-threatening bacterial disease. It is a localized infectious disease which usually attacks the throat and the nose mucous membrane. Slender. They are gram-positive, basilic, pleomorphic, non-motile, non-sporing. The Chinese letter or the cuneiform arrangement snapping division will be spaced like this, like V or L shape. The stains are irregularly arranged, tends to get easily decolorized. They may show the clubbing at one or both ends. Polar bodies, metachromatic granules, gelatin or Bavis airness granules. Metachromatic granules, they are made up of polymetaphosphate, bluish purple color with a lophus methylene blue. Special strains like Albert's Neisser and the Poders. They grow aerobically at 37 degrees Celsius. Virulence factor, exotoxin, they are protein in nature. They are very powerful toxin. They are responsible for the all pathogenic effects of the bacilli. They are produced by the virulence strains 58,700 kilodalton to. They have the two fragments, which is A and B. A which contains 21,500 and B which contains 37,200 kilodaltons. Epidemiology. The habitat, they are present in the nose, throat, nasopharynx and the skin of carriers and patients. They are spread by the respiratory droplets, usually by the convalescent or asymptomatic carriers. The nasal carriers harbor the bacilli for no longer time than the pharyngeal carriers. The local infection of the throat is toxemia. The incubation period of the diphtheria is 3 to 4 days. Pathogenesis of the diphtheria. In the early stages, they have the sore throat, low fever and swollen neck glands. In the late stages, they have the airway obstruction and the breathing difficulty and shock. Pathogenesis. As I said before, they are toxin-mediated toxemia but never bacteremia. Their entry will be in the bacilli, multiply locally in the throat, elaborate a powerful exotoxin, spreads by the bloodstream, produce the local and the systemic symptoms. The local lesions, the respiratory systemic is toxin, the skin lesions will causes in the organism. Respiratory diphtheria, the commonest form of the diphtheria, which affects the tonsil and the pharynx. Facial diphtheria followed by nose and pharynx and larynx. The incubation period is nearly 3 to 4 days. Causes. This is the two pillars of the mucous membrane. Anterior is known as palatoglossal arch and the posterior is known as palatopharyngeal arch. Between these two arches is the palatine tonsil. Facial diphtheria. The exotoxin causes the necrosis of the epithelial cell and liberates the serous and the fibrinous material. They causes the mucosal ulcer. They forms the leathery grayish white pseudomembrane. The fibrinous exudate with the disintegrating epithelial cell, leukocytes, erythrocytes and the bacteria. Diphtheria. Here we notice the pseudomembrane in the posterior pharynx. It can become very large and may be obstruct the airway. Extension of the pseudomembrane. They may extend and cause the larynx and bronchial airways, fatal airway obstruction. This is called asphyxia. Bull neck appearance, massive tonsillar swelling and the neck edema, foul breath, thick speech and the stridor, that is noisy breathing. Cutaneous diphtheria. This is the ulcerative lesion with the necrosis, rarely sodium membrane formation, not toxin mediated, non toxigenic strains, increasing in the vaccinated children, antitoxin positive in vaccinated, preventing the disease. Systemic complications like polyneuropathy, they are toxin mediated, non inflammatory demyelinating disorder, cranial nerve involvement, peripheral neuropathy, and the ciliary paralysis. Myocarditis, the arrhythmia and the dilated cardiomyopathy. Others, they are pneumonia, renal failure, encephalitis, and the cerebral infection and the pulmonary embolism. Laboratory diagnosis with the specimens spark from the lesion. Microscopy is nearly gram stain positive bacilli, like they form the pattern like Chinese letter. In the Albert stain for the metachromatic granules. And in the culture, the isolation of a bacilli requires the media enriched with the blood serum of the egg, the blood agar, lower serum slope, which contains the rapid growth, and the takes nearly period of time is 6 to 8 hours. Selective media, tellurative blood agar. Tellurate is reduced to tellurium, gives a grey or black color to the colonies. In oilous media, the modifications of the TVA. In tin seed medium, they are converted to the cysteine. Laboratory diagnosis, again we can go with the biochemical reaction. This serum water. They ferment the sugar with acid formation but not gas. The ferments glucose, galactose, maltose, and dextrose. Resistance to light, desiccation and freezing, and sterilization, which is sensitive to heat, tested in 10 minutes at 58 degrees Celsius or 1 minute in 100 degrees Celsius, and there will be a chemical disinfections. In the virulence test, the test for the toxicity. In vivo test, the animal inoculation guinea pigs. Subcutaneous test, intracutaneous test. In vitro test, LX gel precipitation test, tissue culture test. Virulence test in vivo test, the bacterial growth from the leaf serum slope is emulsified in 2 to 4 ml of growth. Two guinea pigs, GPA and GBB. Subcutaneous test, which contains a 0.8 ml of emulsion, is injected SC into each guinea pig. In intracutaneous test, 0.1 ml of emulsion is injected IC into each guinea pig. LX gel precipitation test. Filter the paper saturated with the antitoxin. This is placed on the agar plate with 20% of the horse serum. The bacteria culture sticked at the right angles to filter the paper. Here we can look for the treatment. Specific treatment must not be delayed if the clinical picture suggests of the diphtheria. Rapid suppression of the toxin producing bacteria with antimicrobial drugs like penicillin or erythromycin should be given. Early administration of the antitoxin, which is 20,000 to 1 lakh units for the serious cases, half the dose being given in IV. Prophylaxis, active immunization vaccination, formal toxin and the adsorbate toxin can be given for the diphtheria and the tetanus. Schedule is primary immunization is infants and the children. The 3 doses is 4 to 6 weeks interval, and the 4th dose after a year 16 to 24 months booster at the school entry. The booster immunization can be given to the adults at the TD toxins used. Traveling adults may need more, like a booster vaccination. Passive immunization ADS, anti-diphtheritic serum antitoxin made from the horse serum. Combined immunization, first dose of the adsorbed toxin plus ADS to be continued by the full course of the active immunization. Thank you.